So what are laser eye surgery risks? I always reassure my patients that we know that there are complications following laser surgery. They can happen, and because we know them, we do the best we can to prevent them from happening. Fortunately, the risk of serious eye problems after surgery for laser is very minimal. There are different forms of laser surgery. Each carries its own specific or respective risk. And I'll start with laser surgery for glaucoma. With laser surgery for glaucoma, some patients may have a little bit of discomfort of the procedure. They may have a bit of light sensitivity or irritation or redness, which usually resolves after a day or two with drops. With laser surgery for diabetes, some patients may have a bit of residual swelling of the retina after the procedure, which also resolves quite often after a few days or weeks without any treatment. Now, the most commonly performed surgery, which is refractive laser surgery, also carries a few risks. Thankfully, the risk of serious problems are very, very minimal. Most patients go through the procedure with hardly any complications at all. Some patients may experience a slight decrease in vision or loss of contrast sensitivity, meaning that they're not able to determine clearly the difference between different shades of color, or if they're looking at something against not a very clear background, things don't appear that clear. Some patients also lose what we call best corrected distance visual acuity, which means that their vision isn't as good as it was before the surgery with their best correction. The risk of serious complications like infection or actual loss of vision are very, very minimal indeed. And that's because we take the best steps to prevent that happening. We ensure that we have the latest equipment that are very well cleaned and prepared. Most of the time we use what we call custom packs, which come already pre-sterilized, which reduces the risk of infection. And we also take necessary steps like giving post-operative drops to prevent infection and inflammation. So by and large, I'd say that it's a very safe procedure, so long as there's an indication for performing it. And so long as you've assessed your patient, your surgeon, and feel that they can operate on you, I think it's a good option.